Everyone, welcome back to the deep dive. Today we have a very special, a very unique mission. We are climbing two mountains at the exact same time.
Two mountains at once. That sounds, well, exhausting.
It does, right?
Yeah.
But we have to do it. Mountain number one is learning English, and mountain number two is understanding the United States healthcare system.
Oh, wow. Honestly, I'm not sure which mountain is harder to climb. I mean, I know native English speakers who are completely lost when they look at their medical bills.
Exactly. It is a confusing maze.
Yeah.
But that is our goal today. We are going to take these heavy, super complicated government reports and insurance guides, and we're going to break them down into simple, slow, and clear English.
Think of us as your translators today. We aren't just translating hard English into simple English. We are translating bureaucracy into real life.
I really love that. So, to you, our listener, do not worry. We will speak slowly, we will explain the hard words, and we will help you survive the American medical system without losing all your money.
Or your mind.
Right, or your mind. So, before we even talk about doctors or hospitals, we have to talk about money. There are three big words that you will see on every single insurance paper.
Yes, the big three. If you don't understand these three words, the system will kind of eat you alive. They are premium, deductible, and copay.
Let's start with the first one, the premium.
The premium is probably the easiest one to understand. It is just a subscription fee. So, do you have Netflix?
Oh, of course I do.
Right, and you pay Netflix every month, yeah. Even if you don't watch any movies that month, you still have to pay them. That is your premium. It is a fixed cost just to have the insurance card sitting in your wallet.
Okay, I get it. High premium means I pay more every month. Low premium means I pay less. That's simple. But then we have the second word, the deductible. This is the one that makes people really angry.
It definitely does. It's the hurdle. Imagine you are running a race. The deductible is a giant wall you have to jump over before the insurance company starts to help you run.
So let's say I buy an insurance plan with a $1,000 deductible.
That means for the first $1,000 of your medical bills, you are totally on your own. You pay the first dollar, the second dollar, all the way up to $1,000.
Wait, so the insurance company is just watching me pay my own money?
Exactly. They are just standing on the sidelines cheering you on. But once you pay that $1,000, you have, quote, met your deductible, and now the insurance company jumps in and starts paying the bills.
This is a really important strategy point for you listening right now, because you can choose a plan with a low premium, a cheap monthly fee, but it usually comes with a huge deductible wall.
Right, it's a gamble. You are betting that you won't get sick. Because if you do get sick, you have to pay a lot of cash before the insurance actually helps.
Okay, so that brings us to the third big word, copay.
Think of a copay as a cover charge at a nightclub. Every time you walk into a doctor's office, you pay a small, flat fee. Maybe $20, maybe $50. It's just the cost of entering the room.
So, to review, premium is the monthly subscription. Deductible is the big wall you have to climb. And copay is the little entrance fee at the door.
You've got it perfectly. Now let's put this vocabulary into the real world. I want to tell you a short story about a little boy named Timmy.
Oh, poor Timmy. What happened to him?
Well, it is Saturday morning. The sun is shining. Timmy is playing soccer in his backyard. And suddenly, crack.
Oh, no. That sounds bad.
Timmy is on the ground. He is screaming. His parents run over, and Timmy's ankle is turning purple. It is the size of a grapefruit.
Okay, this is a classic panic moment. It's the weekend. Your regular doctor's office is closed. So where do you go?
This is your first big decision in the U.S. system. You generally have two choices, the ER or urgent care.
The ER, the emergency room.
Yes, and urgent care. Now, most people, when they panic, they just drive straight to the ER.
Because it's a hospital, right? They have all the big machines and doctors.
They do, but the ER is designed for life and death situations. We are talking about heart attacks, strokes, gunshots, or if a bone is literally sticking out of the skin.
Okay, looking at little Timmy. He is crying, but he is breathing. The bone is still inside the skin. He is not dying.
Right. If you take Timmy to the ER, two things are going to happen. First, you will wait. You will wait for hours and hours because the doctors are busy saving people who are actually dying.
And what's the second thing?
You will get the bill. The average cost of just walking into an ER in America is incredibly high. If you don't have good insurance, it can be thousands of dollars, literally thousands, just for a sprained ankle.
Wow. That is a very expensive game of soccer. So the better choice for Timmy is urgent care.
Yes. Urgent care is like a mini clinic. They are usually located in small shopping centers, next to the grocery store or a coffee shop. They have x-ray machines. They can stitch up small cuts. They can treat fevers.
And the cost? Is it better?
A tiny fraction of the ER, maybe $100 or $150, and you're usually in and out in about an hour.
So the rule of thumb for our listeners is, if you aren't afraid you're going to die right now, try to go to urgent care first.
Exactly. Save the emergency room for true emergencies.
Okay, so Timmy went to urgent care. His ankle is wrapped up nicely. He's eating ice cream and he is happy. But now his parents need to pay. Let's talk about where people actually get this health insurance.
Sure. For most working people in the U.S., they get it from their job. But what if you don't? What if you are a student, or you work for yourself, or you just moved to the country?
This brings us to a very famous and sometimes confusing term, Obamacare.
Also known officially as the ACA, the Affordable Care Act.
There is a big misunderstanding here. A lot of people think Obamacare is free insurance given to you by the government, like a gift.
It is definitely not a gift. Think of Obamacare or the marketplace, like Amazon.com. The government built the website. But the products being sold on that website are from private companies, like Blue Cross or United Healthcare.
Oh, I see. So it's a shopping mall for insurance.
Correct. But it is a very special shopping mall. It has two magical rules that change everything about American healthcare.
Okay, I love rules. What is rule number one?
Rule number one is the subsidy. That is a fancy English word for a discount.
Everyone loves a discount.
They do. If you don't make a lot of money, the government gives you a kind of coupon to help pay your monthly premium. For some people, this subsidy is so big that their insurance is almost free every month.
That is a huge help. And what is rule number two?
Rule number two is about pre-existing conditions.
Oh, this is vital for our listeners to understand.
Yes. In the old days, before 2014, if you had cancer or diabetes or even asthma, an insurance company could just look at you and say, no, you are too expensive. We won't sell you insurance.
That sounds incredibly unfair.
It was terrible, but under the ACA, that is now illegal. They must sell you insurance, and they cannot charge you more just because you are already sick.
That is a massive relief.
Yeah.
So if you are moving to the U.S. and you already have a health condition, you can still get coverage. But there is a catch regarding when you can actually buy it, right?
Yes, there is. The window to buy is not always open. We call this open enrollment. Usually it runs from November 1st to January 15th.
So it's like a store that is only open for about 10 weeks a year.
Basically, yes. If you miss that window, you cannot buy insurance for the rest of the year, unless you have what they call a special life event.
What counts as a special event, like getting married?
Getting married, having a baby, or, and this is super important for our audience, moving to the United States, that counts as a special life event, so you can buy it then.
Okay, perfect. So Timmy's parents bought their plan on the marketplace. They're covered. But now let's fast forward a bit. Let's look into the crystal ball. We are getting older. We are finally celebrating our 65th birthday.
Happy birthday. You look fantastic for 65.
Thank you. I try to eat my vegetables. But now that I'm 65, the rules of the game change completely, don't they? I am leaving the private marketplace and entering the world of Medicare.
Yes. Medicare is the federal health insurance for seniors. And honestly, if you thought the other stuff was confusing, Medicare is, well, let's call it an alphabet soup.
Because of all the letters. Part A, Part B, Part C, Part D.
It's a lot to memorize. But we can simplify it. Think of it like building a house.
Okay, I'm listening. Build the house.
Part A is the foundation. It stands for hospital or admission. It covers you when you have to actually sleep at the hospital.
And for most people, Part A is free, right?
Yes.
Yeah.
If you worked in the U.S. for at least 10 years and paid your taxes, you don't pay a premium for Part A. It is basically a reward for your years of hard work.
Okay, so the hospital bed is covered. What about the doctors?
That is Part B. Think B for basic care. Doctor visits, blood tests, x-rays.
Is Part B free too?
No, it is not. You have to pay a monthly premium. In 26, it's around $185 a month.
That seems reasonable for healthcare.
It does seem reasonable until you get sick, because Part B has a very dangerous trapdoor built into it.
A trapdoor? What do you mean?
Well, Medicare Part B only covers 80% of your medical bill.
Okay. 80% is pretty good, isn't it?
It sounds good. But you are responsible for the other 20%. And here's the scary part. There is no limit to that 20%.
Wait, let me do the math. If I have a very complicated heart surgery and the bill is $100,000,
Then you have to write a check for $20,000.
and if the bill is $1 million,
You owe $200,000. There is no cap. It can completely bankrupt people.
that is terrifying. I thought Medicare was supposed to take care of seniors. How do people protect themselves from this 20% trap?
You have to buy a shield. And you have two choices for your shield. Choice number one is called Medigap.
Medigap, like filling the gap.
Exactly. You pay a private company a monthly fee, and they agree to pay that scary 20% for you. It safely closes the trap door.
Okay, that sounds safe. What is the other choice?
The other choice is Part C, also known as Medicare Advantage.
Ah, I like to call this one the combo meal.
That's a perfect way to describe it. Private insurance companies take Part A, the hospital, Part B, the doctors, and usually Part D, the drugs, and they bundle them all together into one simple card.
Just like getting a burger, fries, and a drink all together.
Yes. And often they throw in a free toy like dental coverage or a free gym membership, which regular Medicare doesn't actually have.
That sounds amazing. Why doesn't everyone just do that?
Because of the network. Remember our urgent care story. With Medicare Advantage, you usually have to use their specific list of doctors. You lose the freedom to go to any doctor you want.
There's the trade-off. You get the fun combo meal, but you have to eat at their restaurant.
Precisely. Whereas with original Medicare and Medigap, you can go to almost any doctor in the whole country.
Okay, we can't forget the last letter in the soup, Part D.
Part D is for drugs, prescriptions. You buy a separate plan just for your medicine.
So let me recap the soup for our learners. A is hospital, B is doctors, but watch out for the 20%. C is the private combo meal, and D is for drugs.
You passed the test.
Phew. Okay, let's step back from the alphabet for a minute. We have insurance, we know the big money words, but there's a very practical challenge that our listener feedback mentioned. How do you actually find a doctor?
This is a lot harder than it sounds. You can't just walk into a clinic and say, hey, I live here now, please cure me.
Right. You need a PCP, a primary care provider.
This is your main doctor, the quarterback of your health team.
Our sources suggest a specific way to find one. Step 1, look at your insurance website.
Because you have to stay in network. We mentioned this before. The network is like a VIP club. If your doctor is in the club, the insurance pays. If the doctor is outside the club,
You pay everything.
Yeah.
So check the list online. Step 2, call the doctor's office. And here is the golden phrase for our English learners. You must memorize this exact sentence.
the sentence is, are you accepting new patients?
Are you accepting new patients?
Many good doctors are completely full. They are closed to new people. So you have to ask this question immediately.
And a quick pro tip from me. Don't wait until you are sick to make this phone call.
Oh, that is such good advice.
Yeah, if you wake up with a high fever, you don't want to be calling 20 different doctors trying to find one who will see you. Find a doctor when you are healthy.
Yeah.
Go in for what they call a wellness visit.
Get yourself into their system. That way, when the flu actually hits, you are already a patient. They will make time for you.
All right, we have one final topic today. It's a little serious, but very practical. We found some great advice from the state of Oregon about disaster preparedness.
This is something people forget all the time. In the U.S., we have hurricanes, wildfires, ice storms. If you have to evacuate your house or if the power goes out for a week, what happens to your daily medicine?
If you take heart medicine or insulin every single day, running out is a disaster.
It is genuinely life-threatening. The advice from the government is to always have a go bag. And inside that bag, you need a list. Write down the exact name of your drug and the exact dosage.
Because if you end up in an emergency shelter in a different city saying, I take the small blue pill, is not enough information for a pharmacist to help you.
Exactly. And there is a special rule during emergencies. Usually your insurance won't let you refill your medicine too early, but if the governor declares a state of emergency, you can often get an emergency refill right away.
That is really good to know. Speaking of drugs, there is one last weird thing in the U.S. system we need to mention before we go. The donut hole.
Ah, yes. The coverage gap.
Why do they call it a donut hole? Is it delicious?
It is definitely not delicious. It's a hole in your insurance coverage. In Medicare Part D, the drug plans, there is a very strange phase.
How does it actually work?
At the beginning of the year, your insurance pays for your drugs. You pay a little bit, everyone is happy. But if your total drug costs reach a certain high limit, you fall into the hole.
And what happens inside the hole?
Inside the hole, the insurance company steps back and you suddenly have to pay a much higher percentage of the cost out of your own pocket.
That is so confusing. So you pay, then they pay, then you pay again.
It is very confusing. Eventually, if you spend enough money, you come out the other side of the hole into something called catastrophic coverage, and the price drops again.
It sounds like a roller coaster that nobody wants to ride.
It is. But if you take expensive medications, you just need to know that the price at the pharmacy counter might suddenly change in the middle of the year. Don't be surprised. It's just the donut hole.
Wow. We have covered a massive amount of ground today. We went from Timmy's ankle at urgent care to the Obamacare marketplace, all the way to the Medicare donut hole.
We really did a deep dive today.
You know, when I look at all of this, all the choices, the plans, the networks, I realize something kind of profound about the American system.
What's that?
It is a system built entirely on freedom. But the price of that freedom is complexity.
That is a brilliant insight. In many other countries, you don't have to choose anything. The government just covers you. It's simple, but you have less control.
But here in the U.S., you have total control. You can choose your deductible, your doctor, your drug plan. You are the boss.
Yeah, but being the boss is really hard work. You have the responsibility to understand all the rules. If you don't read the fine print, you lose money.
That is the big trade-off. Is the freedom of choice worth the complex alphabet soup? That is a question every single person in America has to answer for themselves.
And hopefully now you, our listeners, are better equipped to answer it too.
Absolutely. So keep practicing your English every day. Remember the magic phrase, are you accepting new patients?
And remember, urgent care is much cheaper than the ER.
Stay healthy, everyone. Thank you for joining us, and we will see you on the next Deep Dive.